Record to this. There we go.
Need to press OK.
So we have already decided before I hit the record button that you were going to call me Tom and I'm going to call you Edward. Very much appreciate that. And thank you for coming on and doing this interview with me. I'm so grateful.
Yeah, thank you for having me here today.
Yes, it's great because we have so much in common. And I'd like to begin, of course, right off the bat with a discussion of my favorite book by Viktor Frankl, which is Man's Search for Ultimate Meaning.
Mm-hmm.
And as a minister in the church, it's very meaningful to me. And when I was working on my certification in pastoral logotherapy, and I did a final paper, I sort of zeroed in on what we think of as the thesis statement of that book, that there is a religious sense deeply rooted in each and every man's unconscious depths.
Mm-hmm.
But as a pastor, I decided to read on a few more sentences after that, where he wrote, "This may break through unexpectedly, even in cases of severe mental illness, such as psychoses."
Mm-hmm.
And then from there, I located case examples in that book, also in The Will to Meaning, and in an essay entitled Psychotherapy, Art, and Religion. So I identified 6 thesis statements, and I thought it'd be neat if we just started out by kind of talking about those thesis statements that he made and how we can relate them via logotherapy and into the spiritual realm.
Yes, absolutely, absolutely.
Thank you.
Yes, so basically, I've been studying logotherapy and the life of Viktor Frankl for a number of years now, and one of the things always is to look at the context when he wrote his books, the different editions. He added material in subsequent years, and also the interpretation is going to depend as well on each reader. Okay, so I try to be as much as possible genuine to what Frankl meant, but of course I have also my own background, and I will have my own interpretation, and especially what I find it useful, so because all this can become very philosophical and even theological, but myself, I am a psychotherapist and also a teacher of logotherapy, so I try to see, okay, so how this can be helpful in my practice, the clients and the students I see every day. Okay, so that's my thing. Okay, so but you mentioned about psychosis, no? And about the religious beliefs in psychosis, and I work in psychiatric hospitals, and I learned from the chaplains, when I was doing my training, and that that people have all kind of different beliefs, and yes, sometimes psychotic people have symptoms that have a religious content, and Viktor Frankl wanted to emphasize that not because something is said by somebody who have a psychotic illness is not necessarily, a belief system. All right, so and then he gives examples of different religious people throughout history, that some authors at that time, when he started to look at his own training in the 1920s, 1930s, they tried to, religion is indistinguishable from psychosis. Okay, there has been debates. Is religion a delusion? So there are a lot of debates in this area. Okay, so that's what he wanted to say. First is that not because a person with psychosis has some kind of religious beliefs, it needs to be invalidated a priori. Okay, so that's one thesis. No? And then in terms of releasing religiosity, so what do we mean by religiosity? What do we mean by spirituality? Okay, so interesting, because in the last 20 years, there has been an evolution. For a long time, the religious experience was even avoided by psychotherapists and counselors. Okay? Since the beginning of this century, it was acknowledged that religion and spirituality are important components of people's lives, So it's important to learn to listen, even independent of the religious beliefs or philosophical beliefs of the counselor, to learn to listen and take a religious and spiritual history. Then the issue is what came about is that a lot of people start to define the saying, I'm spiritual but not religious. Okay,
Right.
so all kind of definitions started to arise. No? Okay, so from that point of view, what Viktor Frankl means by religiosity or spirituality, we need to bear in mind that man's search for ultimate meaning had a German title that was The Unconscious God. He wrote that in the 1940s, okay, as a thesis. Then he added other material later on. You know, when he received an award in the United States in the 80s, his speech it was also added. You know, so this is that we need to look at that there has been an evolution even from the time of Viktor Frankl. He passed away in 1997, and then even from that is how the recognition of the spiritual and the religious aspects of people's life is important to acknowledge. Okay, and then in my practice, what is it all this about? Okay, so first of all, is that people have found spiritual practices and religious practices as a component of their own well-being, a way of overcoming obstacles, a way of maintaining their sanity and their mental health. And then there are also, unfortunately, people who have had religious encounters that have been, in a way, harmful for them. You know, when ministers trespass the boundaries,
Right,
or
right.
when there has been teachings that were not philosophically sound, ambiguity in metaphors, you know, the impact it has on people who are vulnerable, you know, to be influenced. You know? So all those are aspects that nowadays are a component of psychotherapy and counseling practice, even if it's outside the context of pastoral care or spiritual care. You know, so there has been an evolution in that regard. So here comes Viktor Frankl talking about this in the 1940s, no? And right. So anyway, so from that point of view, there are some questions that you mentioned here about this neurosis and psychosis. No? Neurosis is a term that not longer used in psychology practice, but looking back in history, okay, so what can be neurosis? Neurosis, how I interpret this, is when there's a self-centeredness that is different from self-care. You know, people preoccupied about themselves.
Nice. Yeah.
They're so preoccupied that they don't come out of it and becomes a problem. Okay. All right. So anyway, so you mentioned, perhaps I will let you ask me some questions and we can get into that.
Sure, but
Understand Frankl's. Yeah.
I really appreciated your approach here from the very beginning, because kind of what we're talking about is Viktor Frankl had his context in which he is speaking about these issues, and our context is a bit different now. And so maybe one of the first things we can do then is we do have to distinguish, I think, in logotherapy, the difference between what we mean by spirituality and religion. And sometimes I don't know if that's even clear in reading Frankl's works. You know, I think we have probably made stronger distinctions than he has in some cases. Does that make sense?
Yes, that makes sense. Yeah, because religiosity can mean many things. For instance, it can mean belonging to a denomination or a particular religion.
Yes.
Okay. There's a sense of belonging in fellowship. It can mean a belief in a power greater than ourselves, like the AA, Alcoholics Anonymous, or a belief in a unique God. Can mean, you know, a unique belief about the spiritual realm. Okay, so all those are religion, where spirituality can be seen as more as a spiritual, as a philosophical endeavor of self-improvement. You know, that not recognize necessarily that there is some kind of spiritual being, but that there's some kind of abstract or non-tangible forces in nature. Okay, so
Yes.
so we have that full range of beliefs. Okay, all right.
And
So
you
so that's
understand from the religious point of view, that's a scary proposition to say that spirituality is just kind of undefined or kind of vague. Uh, and that's always the temptation, I guess, of a minister or somebody in the religious field, is to say, you've got to tighten it up a little bit and be more specific as to what you mean in
Mhm.
terms of the
Yes,
spirituality.
yes, and just saying in the context, because one of the contexts is, well, let's be clear about the history, is that this issue of spirituality as well being brought forth in psychology. It came from the force of um, people, especially in the West, somehow disenchanted with Christianity, who were looking for spiritual alternatives, and the influence of Buddhism practice,
Right,
and
right,
Buddhism, they don't necessarily believe in some kind of deity, but believe in this spiritual dimension. Okay,
right, right.
okay,
Yes.
so that there are some also who have said from spirituality to psychology, from psychology to spirituality. That has been a
Mhm.
little bit
Yeah,
the movement.
right.
Okay, all right. So, and then there's this part of the the understanding of neurosis, understanding of psychosis, the stigma associated with mental health. Okay,
Mhm.
and there's where Frank always in a context. Okay, so to be in a context, some of the issues that we were talking here today, Franco, first of all, said, well, I'm a psychotherapist, as a medical doctor, a scientist, and a lot of um, different religious groups were seeking his advice and consultation. Okay, and
Yes, yes.
okay, so I can provide my philosophy as a way of improving your practices. Okay, and that was his kind of approach to this. Okay, so in that regard, that's why in the Will to Meaning there are all these talks about monks and nuns, because there were um, religious people asking him for his advice how to do an evaluation and who will be successful candidates in living in a religious community, because it's a tough thing, not
Yeah, right.
everybody live in a convent. Okay, so there has been this issue how we assess what are the ideal candidates. Okay, so and
Right.
then has been a practice to ask psychiatrists and psychologists to do evaluations.
Hmm.
Okay, so
I too, I
that's the
had to go
context.
through psychological evaluation for my ordination here,
Yes, exactly.
which is it's a great addition to the process, because before I came to this denomination that I belonged to to a Christian group that did not have the psychological evaluation. And I can say that I worked with ministers who were not healthy mentally, or
Mm,
and the word mental seems to me the wrong word now.
yes, yes.
In the context of logotherapy and existential analysis, mental means psychic or
Okay,
psyche,
the psychological
right?
dimensions.
Whereas we also mean the nous, the spiritual dimension.
Yes, exactly.
So,
Yeah.
and so I think
Yeah,
that's
so the thing about neurosis, no, the self-centeredness. So no, what Franco means by that people with neurosis don't necessarily are not necessarily going to succeed as a religious person. I think where he was coming from is that a person who is preoccupied with the self, who is too self-centeredness, self-centered, has the possibility to change, to transform that self-centeredness into some kind of self-development.
Mhm.
Okay, so they
Yeah.
have this preoccupation with the self. Okay, so let us use that preoccupation that in a way is drowning them, to how we can transform that into self-awareness, self-compassion, self-growth. Okay, I think that's where he was seeing the potential.
I see. Right.
A person with neurosis, not that they keep being neurotic,
Right.
Is that how we can help them to transform that preoccupation into flourishing or into a source of growth.
Yes.
Okay, so that's my interpretation. As I said, we
Okay.
don't have Viktor Frankl with us. Yeah.
Yeah, you really got me thinking about it, because a lot of what I took out of that was that religion tends to cause us to be neurotic, or can lead us. I guess the word we use in English is disorders rather than neuroses. But
Exactly, exactly. So
but
the thing is a old-fashioned word because it meant many things. You know, it became anybody who has a problem or disorder, neurosis, and in the difference with psychosis that people are disconnected with reality. You know, so
right. Okay.
anyway, so it became so general, but in the context is this self-centeredness. You know,
Hmm.
so and from that is a good basis to actually continue with the other questions you
Sure.
might have. Yeah.
Absolutely. Yeah. So how about Um, did you want to look at each of these theses
Yes,
that I
yes,
had mentioned?
yes,
Okay.
yes, yes, okay.
So reading through Frankel's writings, basically he presents case studies from his own work. And of course, the first thesis that I've already mentioned, that there's a deep religious sense rooted in each one of us. And then I included, even in cases of mental illness such as psychosis. The
Yes.
second one comes from the essay, I believe. Psychotherapy handled correctly will release a patient's religiosity, even if that religiosity was dormant and its release was not at all intended by the therapist.
Mhm. Okay.
So I assume here Frankl is speaking to the therapist who avoids religion as much as possible,
Yeah.
but when it comes out, you have to deal with it.
Okay.
Does
Okay.
that make
So
sense?
yes, it makes sense, and also Viktor Frankl's understanding of psychotherapy because he said I'm rehumanizing psychotherapy, but that also has a contentious issue because humanism in the last century was this kind of philosophy that doesn't necessarily mean religiosity. Okay, so that is
Right.
human is at the center of the universe. Okay, I think. Okay, so the thing is this that when one is trying to introduce even philosophically the spiritual dimension as that place where people have freedom, they have responsibility, they have the capacity to see themselves from the outside, they can have the capacity to not just look at themselves but to look at others around them. Okay, all those are
Mhm.
human spiritual capacities that can be described phenomenologically, that means through philosophy. When we introduce these, they are going to come out existential questions people have. Okay,
Right.
so it might come out, yes, a disenchantment with their religious upbringing,
Mhm.
conversions to from levels of self-awareness of their own spirituality, people who abandon their religion, people who were raised up with non-religious and are curious about religion. So these topics are going to arise when we start to introduce this spiritual dimension, at least in the realm of um, philosophy.
Right.
Philosophy. Okay, so that's where he said they handle correctly in the sense that we are not doing the damage of reducing humans to the soma and the mind,
Right.
the body and the mind. Okay,
If it's
so
there, it's going to come out.
it's going to come out,
Right.
yes, because even if it's in terms of um, people's evolution throughout their lives, you say, well, I'm not religious now, I never been, and then they have an opinion. Everybody has an opinion. Religion.
Absolutely. Yeah.
Why or why not? You see, that's already bringing the religious question.
It does. Yeah. Even the word atheist has the word theist in it,
Yes, absolutely.
so
The
it's
atheist is a belief. It's already a belief. We have the agnostics that they say, well, it may God exist or not exist. It's not relevant for me. But then the atheist is a belief. Is a belief that God doesn't exist. That's already a belief. Yeah.
so I think maybe a really good use of our time here would be to talk about then how do we balance this religiosity with, being balanced and not projecting onto people or whatever. And
Yes.
so the thought that I have is, did people other than Frankl feel so strongly that they had to distance themselves. For instance, Carl Jung doesn't seem to have a problem being the son of a pastor, or talking about religion. But there's something about logotherapy where we have to kind of build a fence around it a little bit. Does that make sense?
Well, we can look at Carl Jung, okay, so and his evolution, because Carl Jung, at the end of the day, he was a psychiatrist and psychologist, and he didn't shy away from exploring the religious beliefs of his patients. Okay, right, all right. So there are different things here, because it's first to look at, there is Carl Jung. Okay, so what is the add-on, or what is the contribution of Viktor Frankl? Okay, so because otherwise we just go with the Jungian analysis. Okay, so
Sure.
in my opinion, it's a question of emphasis. Okay, Carl Jung is a lot about self-development, development of the self, integrating the different parts of the self.
Right.
Okay, being self-aware, well-rounded. Okay, where Viktor Frankl, without denying that, he was more in the sense, okay, so how I integrate the person with the world, with nature, with other people. That's where the self-transcending comes. And then the risk of Jung analysis, that if one stays in the self-care, self-growth, that can lead even unintendedly to the person becoming too preoccupied, also
Right.
preoccupied with themselves. You see, so
Mhm.
all right, so that's the emphasis to say, okay, so it's not just a person within themselves, but also how the person is in the world. How the person transcends the self.
Right.
Okay, so that's the contribution of each of them. Okay, so and then as well, okay, another big difference between Frankl and Jung and Freud, and that's what I think captured the attention of many religious denominations, not just Christians, but Muslim, Jewish, is the anthropological view of the person. Is that how the view of the person Viktor Frankl envisioned introduced this spiritual dimension, that human spiritual dimension, that says, okay, so there is a freedom of conscience. Okay, so it's a freedom of the individual, and that's my interpretation. That's necessary to develop a loving relationship. Okay, so that's an interpretation that I think I have seen. I don't think it's just myself. Is how from a theological point of view, the freedom of will can be seen as a gift from God, in order for the human being to be able to love God, because otherwise it will be an imposition. There will
Right.
not be a loving personal relationship. Okay, the flip side of that is that if it's a true freedom, the person can deny it or go against that relationship with God. Okay, so
Yep.
and most religions, as I said, from Islam to Judaism, Christianity, that's the view of the person. That's complete. It doesn't take away the spiritual dimension. Of Freud reduces it to the super ego.
Right. Yes. Yeah.
And Carl Jung reduces to the self. The self. Okay?
Right.
Right. So that's one of the things that. So in a way, um, logotherapy and existential analysis is primarily a philosophy.
Yeah. Right. I agree with
Anthropology. Yeah, and then from there it builds in other um, in other domains, like the domain of theology.
Sure. And just as a little bit of a disclaimer for anyone who's watching this, I want to be clear that my goal is not to baptize logotherapy and make it a Christian, psychotherapy. I don't even practice logotherapy as a therapist, as a pastoral counselor, yes. But most of what I do is deathbed, hospital room,
Yeah.
hallway. I'm not sitting down across in a room with somebody for an hour and working on goals or whatever. So it's a little different for me. If
Yes.
another example is if somebody comes to me, let's say a family member, and says, I want you to do a wedding for me, for
Mhm.
my child. My first question to them is, do you want a Christian wedding or do you want a civil wedding? Because, I'm a minister, therefore typically I will do Christian weddings, but sometimes family members are not religious.
Yes.
So maybe I'm just going to do a wedding for them because I'm their family member. So we leave out that. So I'm not trying in any way to make, logotherapy Christian. I'm just trying to acquire the anthropology and the techniques for pastoral care. And I just want to make that clear. I'm sure you understand that.
Yes, yes. And that has been a tradition in the church. If you look at not just medieval times, the Greek fathers or the
Yeah.
Reformation, the use of philosophy to better
Yes.
understand the nature of our beliefs. So that has been always the case, the relation between faith and reason. But to your point about respecting our clients and not imposing our religious beliefs on clients, this is an important thing. First of all, um, for me, the word respect is more important than the word neutral. Okay, so
Nice.
so how I can, from my religious beliefs, I can be respectful of the beliefs of others. Okay, all right. So, and then in spiritual care, how it has been evolving, yes, is that one works in a hospital and there are people from different denominations, different beliefs or non-beliefs, and then they request uh, spiritual care practitioner. Okay, so
Right.
one is there to listen, to in a way help them to alleviate their suffering. That's what Frankl talks about, the care of the soul. Is in German Seelsorge.
Zorga, yeah.
Seelsorge. Okay, so
And
all
if you
that.
go to seminary in Germany to study for the ministry, do you know what pastoral care is in German?
Yes, Seelsorge. Yes,
Zorga, yeah, yeah,
Seelsorge.
yeah,
Yeah, the Seele is spirit,
yeah.
care of the soul. Yeah,
And
exactly. So.
concern, yeah.
Yeah, logotherapy and anesthesia analysis has been adopted in many contexts of spiritual care practitioners as a philosophy that actually is respectful of individual or personal beliefs.
Yeah.
Okay, Viktor Frankl has this idea that the world is not going towards a unique religion; it goes towards a personal religion. Okay.
Right, right.
All right. Okay. So, and even though this is something that people have pointed out that it started in Christianity with the Reformation, have a personal relationship with the divine, it has been also permeated in throughout the whole church, the universal church, even Catholicism. People are talking now about as well having a personal relationship, with the divine. Okay,
Right.
so this is the kind of thing that one thing that is very helpful, and it comes from my training logotherapy and sensation analysis. When somebody says to me, "Oh, I am belong to this particular denomination or religion," and instead of just assuming that I know that person, yes, okay, so what that means to you, and then they can explain, okay, so what that means to me is the rituals, or what that means to me is the practice that I learned from my parents. What it means to me is many things, meaning, so one can listen and you can see that one cannot just put people in a box. Every authority has a personal story.
Right. Yeah.
Okay, and yeah.
And I found it actually very appealing the way Frankl described this, because today we're not going to just accept the company policy because it's the company policy. We're each going to take our own view of it. And in the business world, young people today are saying, well, I want to work here, but I don't want to do this, and the older generation people say, well, if you're going to work here, you got to do it this way. But now
Mhm.
companies are learning there are too many of these young people who say, I want to see it differently. I guess we call them millennials or Generation Z
Yes,
or whatever.
yes,
It's a little overdone, I'm sure, but I think it's the same in religion that people don't want to just come and say, I want to give you 10% of my income and I'll be here every week and I'm going to volunteer all these hours just because you're here. I think that we have to justify or they have to find some personal justification for doing it.
Yes,
And
exactly.
so I actually welcome that, not completely, but I welcome the idea that they're more invested in how it affects them as opposed to.
Exactly, and there needs to be a meaning behind it. You know, it's beyond the rituals. You know, there's need to be some kind of meaning, you know, behind it, and that's the thing about the relationship between spirituality, spiritual practices, religions, and well-being and healing. Okay, so I think that's something that you wanted to address.
Yes, that's true. Yes. Well, and the other side of all of this is that it's so convenient to use logotherapy to read the New Testament, to read like Robert Leslie's book, Jesus and Logotherapy, where he takes so many different principles of logotherapy and illustrates them. And this is kind of how I really got interested in logotherapy beyond having read Man's Search for Meaning. Um, it just makes a whole lot of sense. But also, and I'll mention that I earned a master's degree in Jewish studies as well. And so I have I'm not an expert, but I have a fairly good understanding of Judaism. And I can also see clearly how so much of his thought proceeds from Judaism, from his relationship to the Maharal of Prague, Rabbi Love, you
Yes,
know, and even in his play, the synchronization at
Birkenland.
yeah,
Yes.
thank you. He mentions there's a very cryptic statement about a group of mystics. They're called the Sedakim. I forget the number, but they're also called the Lamed Nudniks in sort of Yiddish. You're familiar with this terminology, perhaps?
Yes, yes, yes.
So, because he talks about a spiritual unconscious, because he has this background, I think there's a certain amount of mysticism in his approach. And then people talk about how Freud was greatly influenced by Jewish mysticism, and of course Jung, obviously, very clearly. So uh, it's there, whatever we do with it, and we can do logotherapy with people who are not religious, but it's clearly there.
Exactly. So the thing is going back to this anthropological view of the person. Okay, so that's the thing is that if we have this um, understanding or this view that yes, that there is a freedom of will, and the people can make informed decisions. You know, so it's not because there's a very big debate, no, about the freedom of will is exists, doesn't exist. Okay, but then definitely human beings, for human beings, it's important to have that experience of the freedom of will to function in society. That I think most people agree with that. Okay, so beyond any other debates. Okay, so but then the question arises is that okay, so what's the connection between healing, spirituality, well-being, um, health? Okay, all right, okay, so there are all these questions. Okay, so and then as well from a Christian point of view is the question of the the healing aspect of prayer. Okay, so
Right.
well, how we can make sense of all that? Yeah? Because again, it's this question of the faith and reason. No? So yes, I was trained as a physician. Okay, I was a physician. So my role as a physician was to use science to cure and to take care of the sick. Okay, right. So that's clear. Okay, science. But then, as a physician, I recognize that it has limitations. Not everything can be cured. Not everything can be fixed. Okay, all right. So
Right.
because we have mortality. Okay. So all right. So beyond that, how we can improve quality of life when people are more sick. All right. So that's a good inquiry. And what is the difference between treatment, cure, and healing? Okay. Right.
Yes.
So how um, the our ethics, our spiritual beliefs have an influence in taking care of ourselves and taking care of others. Okay, so that is something that can be scientifically explored as well. Okay, so that's something that comes. So in a way, what's the difference between being a minister or being a psychotherapist or a spiritual counselor? Okay, so there are blurred lines, but there are differences too. No? Okay, so and then there's different authors who put okay, there are different. These are the differences I see. Okay, right, but in a way, everything at the end is connected. So a religious practice brings about a good health or the best health possible. Okay, because otherwise we get into spiritual self-harm. That's another.
Right.
Okay, all right.
Yeah.
So that's okay. So the thing is how we can live a life that is a healthy life, that is not in contradiction with one's spiritual beliefs or one's religiosity. Okay, so
Right.
that's a important question. So the important way, because um, for instance, there is something that has come through Christianity and I see every day. Just to give you an example, is the idea of sacrifice or putting others before myself.
Right. I think this is where self-transcendence has to give way to self-denial or,
Exactly. So how, in order to give to others, I need to take care of myself.
mhm.
So that's something that people feel guilty that nurses, okay, I need to take care of myself. I need to, but I'm here to give to others. So how, I
Right.
don't want to become self-centered. What's the difference between taking care of ourselves and being self-centered? So people struggle with these issues, and
Who cares
it's
for the caregiver?
yeah. So it's through dialogue that one can start to to disentangle the confusion. The confusion. Okay.
Yes. Sounds
Yeah.
good.
Yeah.
And so in yourself, you guys have written a book, you and your wife, Dr.
Yes.
Maria Marshall,
Yes.
several books, of course, but I particularly read Healing Ministry, experiences with Viktor Frankl's logotherapy in psychiatry, psychology, clinical counseling, and psychotherapy. You just mentioned the difference between healing and cure, which I think is something that's really profound. Is there what is the difference? I think I know, I'm sure I know what the difference is somewhat, but maybe for the sake of everybody watching, spell that out just a little bit, please.
Okay.
Cure
So
versus healing.
yeah. A cure is more considered physical and psychological restoration of one's health. That's very concrete. Okay. Whereas a healing involves more an improvement in one's own experience of life, or experience of well-being, and experience of quality of life. That is not necessarily correlated with one's health or mental status, okay,
Right.
physical health or mental
Nice.
status. Okay, so that's a main difference at how I conceptualize this. Okay, so for instance, say that chronic pain. There's limitations how much medicine can do to alleviate chronic pain.
Right.
Right, and then how psychological practices, for instance, distress tolerance, pain tolerance, can help alleviate chronic pain. Okay,
Mhm.
all right. So, but then the healing part comes when the person self transcends the chronic pain. It's not just about the distress or pain tolerance, but they said, well, in spite of my pain, I I still have a contribution to make
Right.
to my family, to my community, to my society.
So, for instance, Dr. Jerry Long, I broke my neck, but my neck didn't break me.
Exactly. Jerry Long is as a person who passed away in 2003, and he suffered from spinal injury, and he became quadriplegic, and through responding to his difficult life situations, through saying, okay, so what can I make now of my life? He found meaning, and he found Viktor Frankl, okay, logotherapy, essential analysis, and he became a doctor in psychology. No? Okay, so Jerry Long, for instance, he said that he visited the hospital ward where he did his physiotherapy rehabilitation, and to his surprise, if not everybody, but most of the peers have passed away. So actually, he outlived his peers.
I see.
Okay. Okay. So, and there was a show to say, okay, so the sign that I found meaning and purpose in my life, it was not just something that brought me healing, but actually helped me to live longer.
Yes, right. Not a cure, but healing.
Healing.
Right.
Exactly. So, and then for ministers, in general, what this is one of the struggles I found in ministers. Okay, is that especially Christian ministers who follow the miracles of Jesus. Okay, so how as a minister I can do miracles? Okay,
Right.
So if I want to follow,
Sure.
okay, so and that's a struggle. Did those miracles just happen, at the time of Jesus or as a minister? Okay, so that's a struggle. But first of all, what I wanted to say is that first of all, to know the science behind healing.
Right.
Behind healing. Okay, so that's why psychology, logotherapy education, that's important. To know the science. We are not just doing something that is magic. It's not magic. Okay,
Right.
so know the
Agreed.
science, and then how through the experience and through learning, one can use words that actually are going to offer consolation to the person,
Yes.
are actually going to help that person find meaning in their illness. Okay, and then it's a little bit like putting the ingredients, and then to allow for the religious person to go for God to do the rest. Okay,
That's right. Yes. Yeah.
okay, and that's how healing can happen in today's world.
Yeah, I think that's wonderful because again, I don't offer healing services. I don't
Yes.
plan to cure anybody of anything. But I do believe that healing comes through pastoral care in terms of comfort, consolation, and so forth, and having the ability to do Socratic dialogue, paradoxical intention, things like that. They are useful in pastoral counseling.
Yes.
But I would like to tell you a quick story, if I may.
Yes.
So, going back to Robert Leslie's, I assume you've read the book,
Yes.
Jesus
Yes.
and Look There.
Yes. Yes.
So, briefly describe for people who are watching. In the New Testament, there's a story where Jesus is in a house teaching, and there are these four guys who have a friend who is paralyzed. They want to get him to Jesus because they believe he can heal the young man. So they wind up going to the roof of the house, opening the ceiling and lowering him. Now, the story said, the Bible tells us, the New Testament, that Jesus said to the young man, "Son, your sins are forgiven." So a rational mind will say, what does that have to do with this? And I always thought, as I was taught, he's just trying to provoke the religious leaders that he has the authority to forgive sins. But Robert Leslie, with a logotherapeutic point of view, says that the man was so burdened by guilt that he was paralyzed. And my first thought was, no, that's ridiculous. That's nonsense. But then I found out that there is in medicine a term called conversion disorder,
Yes. Yes.
where people actually have physical symptoms like blindness or
Or
such
face,
things,
yes, they cannot talk. Yeah.
yeah, that have no connection to the mind or the body. At least that's the way we're looking at it. So that Leslie's interpretation was the young man felt such intense guilt for whatever reason that what he needed to hear was your sins are forgiven. Now, of course, in the New Testament, there's the Greek word sozo, sigma, omega, zeta, No, maybe it's a Sigma Omicron. Anyway, we're not doing a Greek lesson here. But it also is translated healing, and it's translated as salvation. And there is that connection in the New Testament. The reason I mention this is because I finally decided to preach my own version of this sermon.
Yes.
And then I did. And then a couple of days later, I got a message from a lady who said, I have suffered from chronic pain for decades.
Mm-hmm.
The reason is, well, first of all, I'm sorry, I've been to doctors who could not help me. I've been to psychoanalysts who could not help me. She said, finally, I know what it is. My husband died by suicide a number of years ago. I grew up Catholic, and according to Catholic doctrine, suicide is an unpardonable sin. He goes to hell. She says, I blamed myself for this for all these years, and she carried that pain in her body.
Yes, yes, absolutely.
And I got cold chills thinking about how there's the connection there, that guilt needs to be healed sometimes, not physically, not mentally, but spiritually.
Spiritually, yes, absolutely.
Yeah.
That taps into what Frankl talks about, this neogenic neurosis. Okay, so that's important. Is that the neurodynamics is that the dynamics of the spirit, they are always healthy. The spirit cannot become sick.
Right.
Okay? But then sometimes we can have a conflict of values, feelings of guilt. And then science took a long time to recognize that ethical dilemmas, that is a spiritual dimension,
Right.
can have an effect on the psychological and physical domain. And now that's called moral injury. There's a term for that.
Right. Yes. Moral injury. Yes.
Exactly. So moral injury is not an injury in the spirit, but it's a situation in the dynamics of the spirit, like an ethical dilemma that can lead towards guilt or a conflict of values, a conflict of conscience, all that it can be a factor that in predisposed individuals originates some kind of a pathology in the psychological or physical dimension. Okay? So that's the recognition. So exactly. So the role of pastors when they are talking about spiritual struggles, as we call it, spiritual struggles, then it's very important, because then human beings, we are relational beings. Okay, so even though for the religious person, they can have a relationship with the spiritual realm, somehow it's important for us to connect with a human being. It's important, and to listen and to hear another human being who is compassionate, who is understanding, who believe in conversion. This was your past. Doesn't need to be like that. It can be different. That has a healing effect in resolving that moral injury.
Right. Right.
Okay, so that's very very interesting, because actually my wife and I, Dr. Maria Marshall and myself, we wrote a book recently that's a logotherapy and existential analysis for the management of moral injury.
Yeah, that's right. Yes.
Okay, so
We need to plug all of your books here if we can.
yeah, and that's a recommended book for anybody who is interested in spiritual care, even for ministers, because I said this. The first thing is to know the science, and then from there build on the spiritual beliefs, because otherwise it can become there can be damage, if one
Right. Yes.
doesn't understand the science.
Yes, and I'll give you an example. We had a lady who was singing in a Christmas concert, and she had an episode. And so the question is, to me, I don't know, panic attack or heart attack. I can't tell the difference. I'm not a doctor. So she gets in an ambulance, she goes to the hospital, they check her out, EKG, everything seems to be fine. Then after they take care of that part, then we start thinking about the mental and then the spiritual. So from my point of view, she had to go to the doctor. She had to go to the emergency room first. But I remembered that her husband had died, and then a month later, her mother had died, and now it was Christmas.
Yes.
So my thought was, this is probably grief that's manifesting itself.
Mhm.
And but then again, like you say, science first, let her get checked out, make sure it's not the body, make sure it's not the mind, and then we go for the spirit. And we sat down and talked about it, and I think that maybe that's what it was. But yeah, absolutely.
Yeah, so anyway, so as you can see how from the point of view of a lay person, and psychotherapists, it's important to have this training in
Yeah,
spirituality and being comfortable, because for trainees it's very important to be comfortable how to take a spiritual history. You're not imposing anything, you're just asking questions. You're interested about the life of that person, but if one doesn't have that training, the practitioners are not going to be comfortable.
right. Yes,
Okay, and also that might trigger sometimes, and that's why the importance of supervision, the practitioner's own spiritual struggles. Okay, so I always even when I teach logotherapy, I try to bring this disclaimer. We are going to talk about this. If you're struggling with your own spirituality, we can make arrangements, because talking about spirituality, if a person has a spiritual struggle, can be triggering and can be a precipitating factor for anxiety, for instance. Okay, so
yeah,
all these conditions are, it used to be, I don't know how people practice in the past, but there was so much miss in the practice of medicine and psychotherapy in general. Yeah.
right. So it seems like logotherapy and existential analysis are very timely in that it helps to bring together both of those
Yes,
things.
and it's a way for people to feel comfortable to talk about something that is more philosophical, more humanistic. Yeah, and that at the same time, for a lot of people, it's important when they go to see a counselor or a psychotherapist, that they are not going to go against their beliefs, or they are going to ridiculize them or put them down. So that's why not just in United States, in places, some therapists choose to disclose their spiritual denomination or religious denominations, just to let them know, look, this is my religious denomination. If you have a problem with that, you can choose to see somebody else.
Right.
And
Yes.
it gives a signal to say, well, this person is not going to go against my beliefs, or going to ridiculize them.
Right. And I also assume that if somebody comes to me as a pastor and says, would you let me come and talk with you? Then they are assuming that I will speak not only as a logotherapist, but also as a pastor, you
So,
know, and
mhm.
but I still try to, make sure that that's very clear,
Yes,
because I can meet somebody at a restaurant and I'm not going to start preaching, to them.
exactly. And also, and knowing the boundaries is important, because as important is for a pastor to refer to psychologists or
Right.
psychiatrists, it's important for the psychotherapist to refer to a pastor.
Yes. In fact, I have a brochure here for a marriage counselor because I
Mhm.
don't do that. So
Exactly.
when somebody in the church says, we're thinking about marriage counseling, my response is, you don't want me to do that because someday I may be preaching about something and you're thinking, is he talking about us? You want to
Yeah.
be able to talk freely and do all that with somebody who's not going to be talking to 500 other people or
Exactly, and
whatever.
that's the richness of having different ministries in the
Mhm.
churches. There are
Yes.
people who have the ministry of doing bereavement groups, or offer spiritual direction, offer couples counseling. There are many ministries that they offer the couples encounters. Don't they?
That's right. Yeah.
Yes.
So getting back, because what I do as a pastor, I like to end, because I know you have just a few minutes left, to talk a little bit about how we can use what we know from logotherapy and existential analysis as preventive medicine instead of restorative or healing medicine.
Well, first of all, is understanding the person, that things can happen to us. and we have the ability to respond to a situation, and then we have the ability to learn skills, to seek support, to deal with a particular situation. So we might face a situation that we are not skilled, or a situation that we feel too alone. Okay. So as a preventative measure is to say, okay, things are going to happen to all of us. The thing is how we are going to respond to them. You know, that's something that can be very preventative, because some people say we can't worry, oh, if this happened, if that happened, I want to feel safe, not safe. You know, the thing is to have the build that confidence to say, okay, things are going to happen. Okay, the thing is what resources, what abilities, what skills, and how we are going to live our beliefs, you know, in that challenge that life might bring us. Okay, so that's a way to be preventative.
That's wonderful. And of course, from my angle, maybe a series of messages, a series of studies, ways that, you know, that we talk about achieving that spiritual, mental health, so that when those situations come, we're better able to handle them and so forth. So,
Yeah, exactly. And that's a recognition, yes, that spiritual resources and spiritual practices can help the person to overcome challenges. And this is the last message perhaps I can say, because this is related to being human, and also is related to the Christian message. Is that suffering doesn't take away the capacity of the person to love. That's a key message. You know that, because
yeah,
just
great.
in my personal life and in the lives that I have witnessed, you know, one can remain kind and loving in spite of our suffering.
Yes, very nicely put.
Yes, yes, that's an interesting meditation.
Right, because that's does not come naturally.
Yes, sir.
It does not come in the instincts, it does not come in the drives. It must
No,
come from the noetic realm, the will to mean
We
it.
have witnessed that in ourselves and in other people's lives, the capacity, and not just a capacity of people who are in the Bible, or Jesus because he was, you know, who he was, you know, the Son of God. Not Viktor Frankl as a psychiatrist, but even what Frankl used that term that's a little bit dated, the person of the street. The person of the
Right,
street is capable of doing that.
that's right. Amen to that. Before we go, I'm just going to mention that today, of course, is Mardi Gras. Tomorrow is Ash Wednesday. We'll be celebrating Ash Wednesday. And to me, it's an important logotherapy point to say that when you give up something for Lent, even if it's caffeine or sweets or whatever, you don't do it from your instincts. You don't do it from your drives. You do it from your spirit. And your spirit will overrule your body and your instincts by saying, not today. I'm going to do this for the sake of Lent. So again, I just love the way that our uh, method of healing agrees or goes well with our spiritual practice there.
Yes,
Uh,
absolutely. Okay.
while we're
So
still,
thank you very much for the interview.
yes,
Always is an interview is a way of being creative and talk about things in a
yeah,
in a in a new way, and also if it helps the listeners, you know, to reflect on these topics and how they can be you know, make them to use in a way that is good for them. That's a excellent aim, excellent
amen.
goal.
It's a bonus, isn't it?
Yes, absolutely.
Well, Dr. Marshall, I know we're calling each other by first names, but Dr. Marshall, I want to thank you again, and my best to your family, Dr. Maria Marshall, and your 5 sons, right?
Excellent.
Cinco niños.
Incredible.
You're blessed, and you are you developed and you run the Ottawa Institute of
Of
Logotherapy.
logotherapy, exactly.
Yes.
Yes.
All right. Wonderful. Got many books, and so I'm sure that many people who watch this already know all about you. But just in case they don't, they need to go and check out your website, and they can find you on Amazon and Barnes and Noble and all those other places.
Okay, thank you very much, and thank you again for having me, and for all the listeners.
It's our pleasure.